You're listening to the Patient Experience Blueprint with Intiveo.
Hello, everyone. Great to have you here for another adventure of our podcast at Intiveo, the Patient Experience. Today, we are super pleased to have Dr. Pharar here joining us. Dr. Pharar has taken a joint venture as far as understanding complex treatment plans, especially how they relate in the sphere of medical and dentistry and that crossover. I've always been a big believer that the mouth is a gateway into the overall health of a patient. And I think there's some really interesting overlaps in two industries that have maintained independence from each other for so long. So it's quite rare you get an expert in both fields and understanding how those fields really should complement each other. So we're super happy to have you here. Can you maybe start off with a little bit about yourself, a little bit what you're doing, and what brings you here?
Yeah, for sure. Thanks so much for having me on, Josh. I really appreciate it. I'm Dr. Jessica Pharar. I went to dental school in the pre-traditional route. I went to undergrad and then went to dental school at UNLV. I was really fortunate there because it's a pretty new school. We didn't have a lot of graduate programs there. So we got the opportunity to get exposed to a lot of things that maybe would have otherwise been seen by a graduate program. When I was there, I was fortunate enough to be accepted into what's called an advanced education in general dentistry program residency in Dallas, Texas at Texas A&M, Baylor College of Dentistry. And they were actually my first foray into that cross communication of the medical and dental community. Our program director had a very close affiliation to the hospital that was there and made sure that we rotated through the hospital and were seeing patients in the hospital service. And during that time, my dad was diagnosed with a terminal form of brain cancer. And I had already, oh, thank you. I had already been working with oncology patients in the hospital service. And so my program director told me to take what I had learned and go home and help take care of my father with what I had learned. And I got to see firsthand how integrating the medical and dental fields helped him get through his treatment a lot more smooth. After my father passed away, I returned to my program, and my program director really focused me in on managing a lot of patients on the oncology service. And so I got to really hone those skill sets and really dial in like what their unique needs were and how to address them as a dentist. When I went into private practice, I was able to take that skill set. The partner dentist that I work with also did a similar residency, but he was in a trauma one hospital. So he brings in more of that trauma side and more inpatient service, whereas I bring in more of the outpatient oncology side for patients. And together, there's a wide variety of conditions that we're able to manage as dentists and help keep those patients more comfortable and help them get through, if it's an acute condition, help them get through their treatment, or if it's a more chronic condition, help them be more comfortable as they go through their care. A couple years ago, so we run that through our private practice, and then a couple years ago, the medical school here in town had a ton of patients that needed to be seen in a provider's resource like we offer, but could not financially afford that. So that's when we developed a nonprofit component to our practice that provides this care to patients who could otherwise not afford the care. And that has been huge and definitely has expanded our skill set as well, because now we're just seeing probably 5 times as many medically complex patients as we were prior to that.
Well, I have a bunch of questions about where this has led on to, but I think the first thing that jumps out to me is, obviously my condolences on your father. I think, I hope there is peace in knowing that probably that experience is living on how you handle patient care in the future and how you can be there for people to either, as you mentioned, help them in treatment or help them in care and help them in comfort. And Maybe you could just dive right into a little bit if you're comfortable with sharing about how did that open your eyes to that patient experience, dealing with a loved one and then, having to manage something that is really complex, did that kind of put a fire in your belly to make this a life mission and to have this story, be emboldened through your career?
Most definitely. My program director always used to say there's three parts to a patient's journey. There's the patient, there's the provider, and then there's the caregiver. And I got to experience the caregiver portion of it when I was helping care for my father. And then when I returned back to my residency, I was continuing as the provider. So I had a much deeper empathy and understanding of what those families were going through with their loved one. It helped me understand also what they needed beyond just medications and prescriptions. And I think that helped shape the programs that we put forth, especially through our nonprofit. There's a lot more emphasis on not just curing the body, but also caring for that dignity of that soul and those people who are going through this struggle. They aren't just a collection of symptoms or disease. There's a person behind that. A big component of our nonprofit is at the end, we do the reconstruction for those patients to help them kind of return as best we can, return them to who they were before they got sick. So whether that's helping address some cosmetic issues, function issues, helping them learn to eat again or speak comfortably, all of those are really important. We take those for granted a lot of times and don't realize that talking and eating is nothing, we don't think about it at all. And then you go through this cancer treatment that makes your mouth really uncomfortable and you don't want to take anything by mouth. You don't want to eat. Things don't taste right. We don't normally address that until, it's too late. And so if we can do things to help those patients be more comfortable before and during their treatment, it makes those outcomes so much better.
Yeah, I couldn't agree more. I think, obviously your father's scenario is personal and it's also complex and it's also, a very big impact to obviously your life and what you've done here. And I think even to a much, much, much smaller extent that even, there are some complex cares where it isn't life-threatening and it's still overwhelming. There's still a lot of information to process. I think of my son who had oral surgery last November, and being in the dental industry, working with 1 in 5 oral surgeons, you think I would have a desensitization around what's happening, what is the procedure, what are the steps, but I mean, I couldn't help myself. I was emotionally attached to the patient, my son, and there is a fear, there's an irrationality, there is all of these emotions that complicate and distract you from what you're facing. And I think often we need better care to help the caregivers, because the patient is either, my son's case, unaware, and maybe in your father's case, less impactful for him than it was for you as the caregiver. And I think having, in a sense of, it's hard for the people that have to be with loved ones that are going through these treatments. Sometimes, especially in my experience, it's the loved ones that actually take the brunt of that journey. Because those end up being a lot of the memories they store. So maybe you could tell me a little about how you work with caregivers, how you ensure that journey is as humane and as empathetic as possible given the circumstance they're in.
For sure. So because we do see a wide variety of medically complex patients, the involvement of the caregiver is always variable, because we do include special needs patients under that umbrella. So for those caregivers, it's pretty much 100% on them, versus some of our oncology patients. We do have younger patients as well, but we also have some older patients who are ambulatory and can take care of themselves as well. So one of the biggest things that we do is we involve the caregiver when we are doing our first intake appointment. We usually ask them to be with the patient in the room with us. For some of our special needs patients, sometimes the conversation is primarily with the caregiver. We want to know what are comfort items, what are comfort sounds, what are things that stress the patient out, what are triggers. A lot of that we're only going to learn from the caregiver. What are things that they use to soothe the patient, keep them comfortable at home? How do we de-escalate a situation if the patient is uncomfortable? For some of the more ambulatory patients, for the caregivers, we check in on them. We make sure they're taking care of themselves, making sure they're doing the best they can as well. For caregivers, it's a lot. Checking in with them emotionally, making sure they are doing all right. Sometimes we have to consult with the caregiver separately from the patient too. I remember very clearly one of the oncology patients I was seeing, the patient himself was probably like 17 or 18. He was finishing up high school, and we knew his diagnosis was terminal when I was seeing him. And every appointment his mom would bring him, and she was just bawling every appointment because she knew what was going to happen to her son. And the patient had to be so emotionally strong for his mother to be like, it's okay, mom, I'm getting through my care. Okay, I can do this. And I remember one time I just needed to pull her aside and say, you need to get it together for your son. Like, he's the one who's going through something that's really hard. I understand this is really difficult for you too. And you don't want to leave him with these memories of, this is how my mom handled what I went through. And I understand losing a child at that age and watching him deteriorate was terrible. And I also knew for that patient, it wasn't good for him. Like, he couldn't go through his treatment or make good decisions as to what treatment he wanted to pursue because of some of that guilt that his mom was putting on him. And as caregivers, we don't realize that, sometimes a patient might prolong doing treatment even though they don't want to keep pursuing it, because they feel like, oh, I don't want them to feel like I gave up or I stopped, right? And it's hard because obviously I was there too with my family when we were making decisions like that. And at the end of the day, you want to do what's best for your loved one, right? And respect their dignity, and whatever emotional decisions we have to make, kind of leave some of that at the door and say, like, hey, I'm here for them 100%, and I'm not going to let my personal hangups kind of affect their care.
Yeah, I don't think there's a parent that can listen to that story and not be overcome with emotion, just having to, for a second, put themselves in those shoes. I know even myself personally right now, I think about my 3 children, and
Yeah.
I would be no better. I don't think I would have the strength to manage that. And I would definitely be appreciative of good care that can help support myself and my family through, which would be the absolute worst experience any parent could have.
Yeah.
To outlive their child or to have to deal with a child with terminal illness. Maybe for some people that are less aware of, some of the boundaries, or how does that handoff happen between, dental care and medical care? Are you working together with their doctors on the medical side? Are you having conversations behind the doors? Like, maybe you can explain a little bit of that relationship, how, in the dental industry specifically, I think of, a GP to an oral surgeon referral relationship. A lot of times that communication could be better. A lot of times it's front loaded with the treatment plan. And then they kind of go on a separation period for 2-3 months while that treatment's happening, and then ideally getting that patient back in the cycle of care. I would imagine in these situations, it's much more of a collaborative effort throughout the entire treatment plan. Maybe you can explain some of that communication. What are some of the things that you lean on for the medical side? Where do they lean on for you? I know for me in the last 15 years, there's been a huge focus at my dental office around oral cancer screenings, making sure that we, at least once a year are checking for growth in the mouth. But I'm sure there's a whole bunch of things that have happened and new technologies I would love to hear more from you about. So maybe start off with a little bit of the collaboration between the medical providers and yourself.
For sure. So you hit the nail on the head. The biggest thing is great, fantastic communication between the providers. When I was in Texas, I was very fortunate that the dental school was actually in the medical complex. So it was as simple as walking down a hallway or going downstairs and meeting in the doctor's lounge to collaborate on cases. One of the first things I do whenever I intake a new provider as like a referral source is I get their cell phone right away. I'm not sitting on hold calling through office phone numbers. I expect to have direct contact with the other providers. How we usually liaison here in Nevada, because it's a little bit different because I'm not in the same facility as them. The physician will usually refer over the patient, and then when I intake the patient, I get all of their providers' information, whoever the referring doctor was and who are the other providers on the care team. Because with some of our oncology patients, there's like an oncologist, radiation, surgery, depending on what the treatment plan is. So getting everyone's contact information so that we are in fantastic communication. For example, like a current patient that we're prepping right now, he has already started his chemotherapy. So we have communication with the medical oncologist who's coordinating the schedule for chemotherapy and also the medications, getting us labs so that we can we have to do some surgical procedures for this patient so that we are in a good position to be able to do those procedures for this patient and make sure that we have sufficient time with radiation so they know that he's good and healed up and can start radiation and that we don't have to delay any treatment. So we have to have really precise, good communication to be able to do that. We have like a 2-week window in which we're able to do all this information. So it's really important that we have great communication. For some of our head and neck patients who need surgery, we often get those patients prior to the surgical procedure so that we can pre-plan if we're making obturators or surgical obturators. What does that look like? If there are teeth that I'm concerned about that need to be extracted, do I coordinate that with the ENT of, hey, when you go to do your resective surgery, can we include these in the resection? Or, hey, I need this to be spared so that I'm able to restore something against this. So there's a lot of communication. It's really important, and it doesn't end once the patient starts their treatment. As they're going through care, any side effects that develop, the oncology team will reach out to us. They are also aware of what supportive products or medications we put the patients on to keep them really comfortable during care. And then during all of that, we're also keeping in really high communication with the patient to make sure they're empowered and their caregivers are empowered that, hey, I see my loved one going through this, or I'm having these symptoms. So they feel comfortable coming to us and saying, hey, I need you to help me here because I'm having this side effect or this symptom.
So from the patient journey perspective, is there also a GP involved, like someone who maybe highlighted growth or something and they got forwarded on to an oncologist and then you're getting forwarded on from the oncologist to yourself? Or how does that relationship kind of progress from a patient's point of view?
Sometimes we're getting the patients from the GP, sometimes we're getting them from the oncology team. This is like more of our oncology patient workflow. We have a lot of patients that we treat who have like Sjogren's, or some patients who are even on some of the osteoporosis medications, biologics that can have similar side effects as some of the radiation medications. So we are getting the patients from different medical referral sources, and depending on what the condition is, that's who we're communicating back with. We do have some fantastic GPs or PCPs that we work with that we're able to have really good conversations with. I think it also extends to being able to have really good and open communication with your patients as well. For example, just like in a hygiene check, you check, hey, any new changes to your medical history. We also have during that conversation any planned changes for your medical history. Like, are you having any surgeries coming up? Is the doctor planning to start you on any medications? I just had one just yesterday in hygiene that her osteoporosis is getting worse and the doc's wanting to start her on a biologic. So we had that whole conversation now before she's even starting the medication so that she's aware, hey, there are some potential side effects that can happen to you dentally that really restrict what we can do for you. So it's really important that we approach your care aggressively, preventatively, so that we're not having to cross that bridge with some of those difficult side effects.
So you've talked a lot about communication from the different provider perspective, and I think obviously that's mission critical. You definitely want to know what the left hand and the right hand are doing. That sounds like a lot of work on the patient side or the caregiver side. How do you work in tandem with the GP, with the oncologist, and yourself to communicate all the various needs across all of the different healthcare providers? Are you in sync with these providers and they're getting one message with everything, or is it kind of three tracks they need to manage? How does that patient relationship work when you need them to take medications or get blood work or do follow-up care following a procedure?
So we see it as like we're the quarterback for the patient's dental care. So we have individual communication tracks to all of these providers because sometimes from the medical oncologist, I'm getting labs, but from radiation, I'm getting planned radiation field and masking, right? So there are different communications that are happening to each of these providers. It's a lot of work on our back end, obviously, that we're sitting and we're on the phone a lot with these medical teams. And this is the care that these patients need. If we could have unified EHRs, that would make our lives so much easier, obviously. And right now, we don't have that. So it's a lot of faxes back and forth, like, hey, here's the most recent labs, here's our mapping plan, or here's how many rads we're planning to do for radiation, here's the area of focus. It's really important to not be afraid to ask these questions either. I didn't know, I wasn't like a dentist born who with all this information. I had to learn and I had to ask the doctors like, hey, why is this important? Why do you need to do this much radiation versus this? How much scatter radiation happens? It's really important to not be afraid to ask the questions so that your patient at the end of the day gets the best care that you can put out.
I think it must be quite interesting because I'm familiar with all the dental schools that you've been to. And I think all of them are actually customers of ours. But from Baylor specifically, I imagine the data at your fingertips is less in your private practice than it was at Baylor because they do have at least the Epic HL7 interface into their Axiom where you can pull some data and see it, where now it is essentially all upon request, is it not?
Yes. It's a lot of, hey, texting someone being like, hey, the patient told me they went in and got labs yesterday. Can you send me over those values? Or patient said they got mapped yesterday. Can you send me over your planned mapping? So it is a lot of legwork on our back end right now. And that's why we feel like it's so important for the medical and dental communities to not be afraid to talk to each other so that we can collaborate and make this communication easier. I'm so grateful that the providers I do work with are super open to like, here's my cell phone, just call me or text me, so that we can keep in the loop about patients. Sometimes I have the patient in the chair and I tell them like, hey, I'll be right back. And I go to my office and I text the provider to say like, hey, I'm seeing this. I think you need to see them like stat. We need to get them back into your office, or I'm concerned about what this looks like. And we're fortunate that because we have really good communication with these providers, there's times we're catching stuff for them too. Like, hey, this patient's, I think, developing a staph infection. I need you to get them in or get them a derm referral. So we're all just treating the same person, right? We're all different components of that same care team. I don't think we have to see the dentist as like, oh, you're just this other person who does this other thing. We're the head and neck expert for that patient. And we have to approach the physicians with that same expertise. You can't be afraid to talk to them.
Yeah, I definitely have noticed that is one part of the industry that people don't have a great understanding of, is that these are the experts of neck and above. And if you have major facial trauma, like a rebuilding of a jaw due to some sort of accident, that's not a plastic, I mean, plastic surgeon might do some touch-ups at the end, but functionally, the fix is on the dentist's hands. They are the ones that need to rebuild the jaw, rebuild the bone, and make sure everything's aligning correctly and is functionally suitable. How have you seen technology in your career advance, and what are some of the really cool things that you think are just around the corner that we should be looking forward to? Because obviously this conversation is a little bit grim if we're being real with ourselves. And hopefully you have a sense of humor to lighten up your life a little bit.
Oh, definitely.
But what are some cool things that you're seeing? What are things like I just saw a company called Pearl that's doing advanced imaging AI to help providers spot things that maybe the naked eye wouldn't catch. Is there anything else that you're seeing out there that gives you hope that we're maybe on the edge of a brighter future for cancer patients, especially since we're probably all aware that cancer is on the rise in North America, and we need to be better at preventative. We need to be better at diagnostically catching it earlier and then finally treating it when it is there. Maybe you could share some of the advancements you're seeing.
Yeah, so on the front end for diagnostics, I've been super excited. Gonna admit that I've worked with the Veloscope for a really long time, since the beginning of my career. So the Veloscope is obviously a fantastic product for screening for oral cancer and just overall checking the health of those tissues. Oral ID also puts out a great product for like a handheld laser or handheld light to help evaluate tissues or some concerning lesions. I think those products both do a really good job for screening. One of the most exciting things for me, as far as technology has been concerned, is the advent or bringing in of scanners. Sometimes when we're building obturators for these patients, you look at the hole and you're like, how do I even make a record of this to communicate that to the lab? And scanners have been a huge asset for that. They have been able to give us really nice margins to be able to communicate well to the lab as to where our defect is. When we first started doing obturators, we were very fortunate to have a maxillofacial prosthodontist guide us through our first cases, because as a general dentist, they were not in my wheelhouse. And so it was really great in that way to be able to communicate back and forth of sending him scans, telling him like, hey, this is what it looks like. What do you need? Or what do we need to fabricate here? Is this a reasonable case to start with, or is this kind of outside our scope? So that has been huge and so helpful. I can't say enough like how easy it has made some of this care.
It hasn't taken away your job, it's just made it better.
No, not at all.
They abolished that fear right out the gate.
Oh yeah, and we're huge proponents of scanners anyways. We use them otherwise in our practice as well for patient education and whatnot. So I'm so glad that it's yet another way to use this tool. Mm-hmm. There was one more that I wanted
in-office milling or temporary. Is that something that you guys are spending more time finding temporary solutions until a lab could come and find a more functional permanent solution?
Yeah. So really for some of the obturators, the printing has been really nice for that. Mm-hmm. The 3D printing, because you can get them at least a workable provisional much sooner than traditional, like sending out to a lab. And for some of those patients, especially when they're in the healing phase, they're not really going to tolerate a final prosthetic at that point anyway. So having something that's a little softer, a little gentler on the tissue has been great.
Yeah, it's so cool. I feel like we are really, in the last 15 years, pressing fast forward on what is at our fingertips. What are we available to do in the immediate? And I think it's definitely great to see the advancement in 3D technology and lab equipment, finding better, more functional solutions. But what you can create in office with pretty basic milling machines has really advanced quite significantly. What do you do to stay on top of your, ever-evolving career? Are you doing, UNLV courses, or how are you staying on top of this ever-expanding field?
Yeah, so actually I attend a lot of cancer conventions or cancer meetings, conferences, because I feel like they put out a new cancer drug maybe every other week. So it's really important to stay up with it, especially with all the different side effects that the different medications cause. And again, having really good communication with the physicians. If you haven't gotten to train in different parts of the country, you don't realize that medication writing is very regional. What's used in one part of the country isn't necessarily used in the other. And I found that in Texas, a lot of the medications we were using there weren't necessarily what we're using in Nevada. So talk to your physicians too. See what they're writing. Give them feedback too. Sometimes they're trying out a new medication on a patient and they don't realize how much harder it makes our lives. I talk to the physicians of like, hey, like you're putting everyone on Eliquis. Like, I just want you to know, like, these are the issues I get with it versus when you're a patient on warfarin. And so giving them that feedback too can also be helpful. Of course, we're never going to tell them what to write. And having some of that feedback for them helps them understand like, oh, okay, maybe I could write this instead. I do go speak at a lot of medical conventions too, to give them our perspective, because I think it's important for them to understand what we are doing when we're providing care for their patients as well. And so at a lot of those conventions, I learn a ton. I get to see what new medications are coming out. And I just try to have really good communication with providers, but also with like other colleagues who are doing this kind of care in some of these teaching institutions. They really do help me stay more up to date on everything, because it's a lot.
It is. I mean, and the amount of things to learn is evolving every single day. So it's great to hear that you are such a leader in helping that transformation of the industry. And I think to me, the thing that pops out is how much more comfortable I'd probably be willing to have a conversation I may not feel equipped to have with my oncologist with someone like yourself. Dentists are more approachable. Maybe a lot of people would find that hard to believe that they're more approachable than anything, but I believe they would be more than an oncologist.
Definitely.
And I think having yourself be that advocate to give, obviously not directives to the doctors prescribing the medication, but these are the side effects. These are the things they're having troubles with. This is the cause it creates. And for that to be removed from the patient, because I know as a patient, even an informed patient, I feel like I don't really know. I kind of feel like this. I'm not sure if that's normal. And I mean, I went probably 15 years before finding out I don't take freezing. And I always just felt that like when you're a kid and you go to the dentist and you need a filling, the drilling really hurts and it should really hurt. And that's why you brush your teeth, because you don't want to. And then it wasn't until I was like 20 and I started working in dentistry, and a friend of mine who was my dentist gave me a couple units and was like, well, no, you shouldn't, like, you should feel pressure, but not pain. And I was like, well, I feel pain. And we did a test and it took like 8 units to, have my mouth get frozen. And he told me, he's like, no, this is not that unrare for fair-skinned, red-headed people.
Yeah.
And I never knew that. And I lived 10 years of just absolute fear of a cavity, absolute fear of the dentist ever putting his hand in my mouth, because dentists would just be like, well, I've already given you 2 units. You're a child. I'm not going to give you more. Like, we should be able to take a sledgehammer to this thing and you shouldn't feel it. And it just was not the case. And I think having another advocate, especially in these extreme circumstances, would just be an absolute game changer for your patients. So how do people hear about you? What's kind of how do you get on their radar? How do patients who may be feeling like some of their concerns or questions aren't being answered completely by an oncologist, or they want an advocate in oral health as they go through some of these more aggressive treatment plans, how do they get a hold of you? How do they hear about you? Is there other resources they can tap into? Are you regionally servicing patients? Maybe give me a little bit of insight about how people like myself could find you if that ever needed to be the case.
Yeah, so our the nonprofit part of our organization is fairly new. It's only the last couple of years. So we've been trying to build an awareness campaign around it by doing podcasts like this one. I do offer like consultations for patients too. So I am located in Las Vegas, and a lot of my patients have to go out of the region to get care. I have patients who are managed at Sloan, like Sloan Kettering, MD Anderson, UCLA, UCSF, Dana-Farber. Like, I am in communication with all these medical centers. So patients are welcome to reach out to us. We usually prefer the physician to be the referral source, just because of the kind of high level coordination we need if you're going through active care. But we do have caregivers who come across maybe a podcast and they reach out to us and say, hey, I would love my family member if you could at least review their chart. There's patients we've seen in Pennsylvania where they said, hey, this is what my oral surgeon was planning to do. And I told them, I was like, pump the brakes, stop right now, contact your oncologist first, have the oral surgeon talk to the oncologist, and then proceed. And then it wasn't for another year that they were able to do the oral surgery component of the treatment, because it would have been probably pretty devastating side effects if they had just proceeded as is. So we try to help as much as we can, however we can. We do lecture to the general public, to dental societies, communities, and to medical communities, because it's all about building the awareness for this kind of care. And dentists can do this care. This is not like you have to go do residency to be able to do this. I understand that there are patients who may not have access to be able to come see somebody like me. And we will help empower your dentist so that you can get that kind of care too, because I am only one person and I cannot see all the patients. So it is really important for me that we share this information, we get it out to all the providers, so that patients overall have better health outcomes.
Well, a tip for future podcasts is you are allowed to shamelessly plug nonprofits. So how do we find out more about you? What is your nonprofit called? Plug away, because this is obviously not a product of personal benefit. This is a product of community benefit. And I think that's something that our listeners will really want to hear more about.
For sure. It's called the Pharar Foundation. It is named after my father. Oh. We just happen to have the same last name. So it's called the Pharar Foundation. You can see us on socials at Pharar Foundation, and Pharar is spelled Pharar. You can email me at phararfoundation@gmail.com, and I'll be happy to get in touch and get whatever resources we can to you. And you can also learn more about our foundation at phararfoundation.org. And if you have the ability to help us grow, we would love some financial support. We are still in the growing phase, and every little bit helps.
I know that this is such an impactful message. I don't think there's a single person that is listening to it, it's not been impacted through cancer and through those treatment plans. So I think the message is definitely going to resonate. And I can only hope for the best things for you and your organization. I do think, hopefully I can speak on behalf of your father, he would be tremendously proud of what you've done, and that his legacy can live on through the works that you are accomplishing every day in other people. And I think, if only it saves one life, if only it prevents one issue that could have been avoided, if only it makes one person's final days more comfortable, more confident, more at peace, I think this is all worth it. And I can guarantee the impact is thousands more than one. So such a noble cause that you're taking on here. I would love to have our readers to take that time to reach out to you, to investigate, to support you if possible. So you mentioned that a lot of your patients are coming from out of state, or at least that's where their facilities where they're getting their treatment done. Is this something that is typically covered under insurance? Is this something that is, separate from that? How does that typically work from a patient's perspective?
So there is some dental insurance coverage. It's not going to be covered as part of like the oncology care. They'll cover like, hey, you need some fillings or additional cleanings. Sometimes we can get that covered. This will primarily be covered by medical insurance, and the saga of medical billing for dentistry continues. That's part of the reason why we need a little more of this integration, so that we can get better coverage of dental procedures that come from medical conditions covered by the medical insurance.
Yeah, I think, and furthermore, that's why we as people in the industry need to support causes like this, support the foundation, because they're the ones that are able to give underserved people the same opportunity, or at least the same level of information to their GPs, and help support their networks. Any last thoughts or things you want to leave our listeners with before we wrap up today?
The biggest thing is you are an advocate for your care. My goal is for my patients and their families to be empowered to make better decisions for their care. Everyone has a different place or value of how they want their care. And our goal is to educate you so that you can make the best decisions for yourself. And what more could you want for your care?
I couldn't have said it better myself. I think there is, especially in the last 5 years, a really strong desire for patients to become partners in their healthcare rather than subjects of their treatment plan. And I know, the things that you're talking about, being advocates for patients, having that clear communication, removing a lot of the barriers to care and access to care is super paramount to people, especially when there's their treatment plan is a small sliver of the overall well-being while they go through these challenges. And for you to, be able to make that part of that journey better is such noble work. So I do encourage all of our listeners to visit your website to reach out and support if possible. Jessica, thank you so much for your time here. It's been great to learn a little bit more about your foundation and your organization and how you're supporting oncologists as well as patients and GPs across North America. I would love to see a day where we have a universal health record where needless miscommunication and bad decision making isn't because of a lack of technology. And I know it will be in our lifetime, it will be in our careers, and that just makes me so excited to be in this industry, in this field, making a difference with you. So thank you so much from the bottom of my heart for being here with me today. I will let you get out of here.
Thank you so much, Josh.
All right, take care. Have yourself a great day.
You too. Thank you.
Bye.